Right, welcome everybody. Thank you for being here. Can everybody hear me okay? All right, great. Um, yeah, I'm super glad to be here to share with you some thoughts I have on this topic of chronic pain and how posture relates to it. The way this is going to work for this we have about an hour. For the first part of it, I'm just going to share with you some things that I want to share with you. And then in the second part, I'm going to open it up to Q&A session. So during this first part, if you can just keep your mics muted, that'll be great. You can keep your camera on or off. It doesn't matter, whatever works best for you. All right, so just to give you a little bit of background about myself, so you kind of know where I'm coming from. I studied psychology and education and neuroscience. I have a PhD in neuroscience. In particular, I studied cognitive and behavioral neuropsychology, and I've also been involved with massage for a very long time. I've been LMT for 25 years, been an instructor for almost as long, been director of a school of many massage schools, and I've taught just about everything that you could teach in a massage program. And when I first got into massage, I didn't have a thought about what I was going to do with it. I just thought maybe this would be kind of a fun thing to check out. And then I found out when I quickly realized that massage is really amazing and it's a lot more than I thought it would be. There's just so much to it. I think it's such a beautiful, profound, amazing thing that we offer. And I think a lot of times we undersell ourselves, that the should be respected more than it is oftentimes because we're just doing so much. And I think a lot of the narratives that we have for what we're doing as massage therapists uh, really undersells what the amazing thing that we are doing. And part of that is the explanations that we have. I think a lot of us recognize that we're doing something amazing, in which we try to create other explanations for what we're doing that may not be accurate, but they're trying to get to this quality that is, more than just muscles and bones. It's something more profound than that. So that's one of the things that I really like to connect with in my classes is that what we're offering is not so simple. It's complex and it's a beautiful, profound thing. So I hope that I can instill some of that into this little bit of time that we have together today. So what I want to do today is I want to talk about how posture and pain relate to each other and how we can tell that story in a more accurate and more profound way. So, um, I have been around massage for a long time. I'm very familiar with how often the topic of posture is addressed. And I don't know how you've learned about it, but I'm sure we've all heard many of the same stories, this idea of how posture relates to pain and just posture in general without even talking about pain. It's a very common sense view. It's based on our understanding of the world, moving objects around and like basic physics. It's a mechanical view of the world, and it's similar to how we think about engineering. Like we understand that in order to have a bridge that works, we need to have stability with alignment and symmetry, and we need to distribute forces. So a lot of the ways that we talk about posture in massage sounds like we also came out of engineering school. We talk about symmetry and alignment and force distribution and that kind of thing. It all makes a lot of sense. It's very common sense, I would say. There's also an aesthetic appeal to the topic of posture. Like we like things that are symmetrical. That's just, who we are as humans. We like to make gardens and buildings that are symmetrical sometimes. So the same thing is true with bodies. We have a tendency to think that we want things to be symmetrical. There's also some interesting cultural and social influences that I think really don't get noticed a lot, and that is that we like it when people are upright and composed. There's a way in which we we find people who look that way to be maybe more trustworthy or more reliable or more upstanding, so that there's a metaphor in the actual body position of being upstanding. And there's a whole history of where posture the idea of focusing on posture came from, which was really very classist and very much like let's pull ourselves up and look like good, decent people. So anyway, that's we won't go into that today, but um, it created this era of people standing with books on their heads and everything. But it really had more of a social component. It wasn't about this is going to be good for your body. It was going to be good in a social way. So I'm sure you've heard all the things I've shown here. I'm showing here on the screen, but in case you can't see the screen very well, I'm just going to read it out. A lot of the things that we usually find to be problematic, like examples of bad posture, are things like forward head position, or just the idea of having your neck in a forward position, like when texting, having the shoulders rounded forward, anterior pelvic tilt, the idea of sitting for long periods of time, and that throwing things off with hip flexor muscles and creating back pain, or just any symmetries whatsoever. I could add, leg lengths to this list. And, good posture examples are all about sitting up straight, standing straight, having alignment and balance, and, basically opposite of all the things that we just mentioned at the beginning. So, whether you ascribe to this or not, I'm sure that you've heard of all these things before. So how does that all relate to pain? So let me just lay out like the structure of how we think about posture and how we relate that to pain. And that's the normal view that we have in society and in massage therapy. The common belief is that postural imbalances are a direct cause of pain, and that if we have somebody who comes in with pain, that perhaps we could help them by finding a way to balance their posture or create alignment. Um, and for many people, this involves an assessment process called body reading, where we look at the body. We might stand them up with a grid behind them and look and see how things line up, maybe hold a string with a weight on it to see if everything lines up. So some massage therapists do that, some don't. But the whole idea is to check out what the body looks like and then say, oh, okay, well, if this is not aligned, then this might be the source of your problem. There is an assumption that tissue is determined by posture is determined by soft tissues. So if we see something that's misaligned, it has to do with muscles, it has to do with tendons, it has to do with fascia, has to do with ligaments. So like that's the focus of what we're going to work with. So if we're going to change posture, then therefore we have to change soft tissue, and that becomes the target of the session. And then a lot of us think that this is the case because what we notice is that people walk out of our sessions feeling better. And if we had a session where we were focused on some element of posture and they felt better, it sort of kind of reaffirms this idea that we just changed something in the soft tissue, and therefore we we resolve this posture issue, which resolved the pain issue. There's an assumption that there is a universal ideal. There's an external, and by what I mean by external is that we can put it on paper and we want everyone to ascribe to that ideal, as opposed to like customized, like person by person idea. So there's this notion that there is this one form, the earlobe needs to align with a certain part of the shoulder, a certain part of the hip, and a certain part of the ankles, that kind of idea. Okay, so that's the common view that's proposed and in culture and in massage therapy. So I want to talk about that. But before I do, I want to just make sure we're really clear about some definitions. So pain, whenever I talk about pain, we all know what pain is, but I want to be clear that pain is an unpleasant subjective experience. So the focus there is that it's a subjective experience. So you can talk about your pain. Nociception, this is the only neuroscience term I'm going to use today, but we have to use it. Nociception is the neural process that detects danger and or conveys that potential danger. And gnosis is what's the neural process, it's the objective process, the physiology, the anatomy of it. It's not the subjective experience. So um, most or a lot of nociception ends up resulting in pain, but there's plenty of nociceptive activity that doesn't result in pain. And there's a debate about whether you can have pain without nociception. But the point is that pain is the actual experience, and nociception is the underlying neural process that may or may not lead to that. So you can't talk about your experience of nociception. You can only talk about experience of pain. But just remember that there's always nociceptive activity. Like right now, whether you're in pain or not, you do have nociceptive activity happening. It's just a matter of whether it makes it into a conscious experience or not. Okay, and then the last definition, which we have to do, is what is posture? And this might seem very straightforward too, but actually, it doesn't take long to find out that people have different definitions of this if we get into it. So I am going to define posture here as the position that our bodies naturally take, that they want to take. So it's not just any position that you find yourself in. Like if you're a plumber and you're getting under the sink and you're in this contorted position for hours of the day, that's not what your body wants to be in. That's just what your body has to be in. So no, there's no mystery about why somebody doing that would experience pain because they're fighting their natural tendency. Same thing with when you're on a plane for, an 8-hour flight. You don't want to be sitting like that. You want to get up, you want to roll around. You don't want to be just sitting in that same position the whole time. So that's not posture. That's just a position. So what I mean by posture is the position that you would naturally want to be in, whether you're walking or sitting or whatever you're doing. Okay, so um, let's dive in. A nociceptive perspective on posture and pain, this is the first thing I want to convey, is that our nervous system is always making sure that we are having a posture or getting into a posture that it reduces pain and nociception, that minimizes the amount of pain and nociception that we have. We do that without thinking about it. We do it in our sleep. That's why we roll over in our sleep. So there's an automatic setup going on here that um, you're always going to find that position that is the least nociceptive or the least painful. So that right there it seems so obvious, right? But it's completely in contrast to what we just said about how we think about posture in massage therapy a lot of the time. Because if we're saying that posture is causing pain, but we're also saying that we're constantly moving away from pain, and that's the posture we're picking. That doesn't really, those two things don't fit. Um, if you had a position that was less painful, you would go into it. So it doesn't make a lot of sense that we say that the posture is the problem because the posture is actually working for a solution 24/7, whether you're thinking about it or not. Now you might have a situation where nothing feels good. That's a whole other topic. But just to lay down the fundamental default situation here is that we're going to minimize pain at every moment. So we have to rethink cause and effect here. Rather than thinking that pain or posture causes pain, it's actually more accurate to say that nociception or pain influences posture. It's really the cart and the horse the other way around. Okay, so that's the first thing. Now, it's not the end of it. It gets more complicated. Um, but I want to just lay down some of the things that people have found in research studies. So we find when we look at posture and pain in scientific research that we don't find any clear correlation between the two. We find that people who are assuming what we normally think of as bad posture, they don't have more pain than everybody else. And when we get people into what we call good postures, we don't find that they have less pain. Um, so kind of a surprising thing given what we normally think. This popular idea that of text neck is not a thing. I have this picture of this guy from 100 years ago reading a newspaper. Um, the same thing, and I can't find the actual reference for this, but I did see this once that 150 years ago, there were people saying, oh, people are going to have all these neck problems because everybody's holding their head down, looking at reading the newspapers these days. So they had a whole, not text neck, but the same idea, right? And it didn't happen. It wasn't a thing. People have been reading newspapers. It's not a problem. Um, Now we understand where the idea comes from. We know that having your head forward does create a more mechanically challenged situation than having it, not forward. That's true. But does it relate to pain? No, there's no evidence that it does. And if you were in pain, if you sit there in this position for the whole day, yeah, you probably won't like that. And your postural system will say, let's not do that anymore. Um, and then also with sitting, the research shows that it's not sitting that creates problems. It's the non-movement that creates the problems. It's not, you can sit most of the day and not have problems. But if you don't get up and move around, then that's what creates problems. So we've made a mistake by equating this position, this 90-degree angle at our hip, with back pain when it's not the 90-degree angle. It's the like just sitting there, not getting up every hour and just to walk around for a minute. So that's what the research is showing. Um, Now, I'm sure it's very easy to think, well, that's not my experience. I've gone to workshops, I've had retreats and trainings where we did these things around posture and I felt better afterwards. And yeah, absolutely. You feel better afterwards. But the thing is that you weren't controlling in a nice scientific way all the things that were also happening. Another thing that was happening was that you were moving. And the research continually shows that it's movement that reduces pain. And so, I mean, you can't really have a class on posture without having movement along the way. So you got movement, you also have, hanging out with other people, you got somebody taking care of, like watching over you, like caring about your well-being. There's a whole social component. You're also telling yourself, I'm doing this for myself. I'm going to make myself better. Like there's a whole bunch of things that are going on psychologically too there um, that we know actually contribute to feeling better. So um, it's not, but the research just shows that it has nothing to do with the posture itself. Okay, so a couple other things that we need to look at um, with the adaptive qualities of posture. I've already talked about how there's a nociceptive adaptation where we're constantly reducing pain with our posture, but there's also other things that are happening. Our posture is serving to be functionally adaptive. So if you have a task that you do all the time, then your posture is going to start to adapt to that. You have your nervous system telling you like I need to move this way, and then you start to form fascia around that. So you get the form that works for the things that you do on a regular basis. So it's functionally adaptive. Now, that functional adaptation may not be nociceptively adaptive. If you keep doing this one thing that is great for your job, but not great for nociception, and then we have an interesting thing to look at there. Also, we do things that are socially adaptive. So let's say, especially during childhood, if you had a family where you didn't feel safe, maybe you like kept yourself small and like you roll your shoulders forward and just wanted to lay low, not cause any trouble. Do that for 15 years and now you've got a habit. And so you can't just walk into a massage therapist and undo that habit. The nervous system's not going to be cool with that. Your fascia isn't going to just change overnight like that. So, and also if you even got into a new position like that, there'd probably be a way psychologically that it wouldn't feel safe to stand up straight after 20 years of saying this is what feels safe to be to be forward. So there's a whole social thing here. There's a psychological thing too. You're going to adopt postures to project what you want other people to see in you. So, especially thinking about being a teenager, I can remember wanting to stand a certain way because it was comfortable, but thinking, oh, I don't look cool enough, so I better stand this other way so I look cool. So you have this other psychological, social element. And then lastly, there's this really powerful element where we adopt postures to make sure that we don't feel certain unpleasant feelings. And this is a whole huge topic that we could get into um, in a bigger class, but you know, if you could try it out, but there are certain postures where you cannot feel grief in certain postures. You cannot feel sadness in certain postures. So if you want, if you have a whole bunch of grief that you don't want to be in touch with, you could just adopt those postures 24/7, or at least when you're awake. And voila, you don't have to feel that pain and that emotional pain. So all of these things are going on all at the same time, and they may or may not, um, relate to each other. So, um, these psychosocial and the functional needs may clash with the nociceptive adaptation. So you may want to look cool, but the nociceptive system says, yeah, this doesn't feel comfortable, which is more important, being comfortable or looking cool, or being comfortable or not feeling emotional pain. Like, you have some choices to make. And I would say that quite likely in many cases, the psychological ones are gonna be dominant because it's easier to deal with physical pain than it is to deal with emotional pain. So anyway, whatever ones we adopt over time, those are gonna get kind of fixed. We adopt them with our nervous system, but then they can become more fixed with our soft tissue. So, given all this complexity, and I think that complexity is this beautiful, interesting thing that's much more interesting than what I started with, that it's just this mechanical thing and that's it. I'm not saying we shouldn't care about posture. I'm saying actually posture could provide some really interesting insights into what's going on for the person, but it's so much more rich than what we normally think. And what we normally think of, oh, let me just push this thing into position and change your soft tissue, and then you'll be better. That's not true. Well, we know it's not true from research, and it just doesn't. There's too many factors that are all interwoven with each other. So we have to think about all those different factors, and so it gives us a really interesting place to explore. Like, well, why are you standing this way? Why is that position the one that you choose? Maybe it's because this other position hurts, or maybe because of these psychological reasons. So. Um, we can do more with posture than we normally do, I think. But it should never be a goal. What we need to do is let go of this idea of trying to get people into a certain fixed external idea of posture and really focus on the person's internal experience, what I would call interoceptive experience. What's going to be good for them? Because maybe there is another posture that would be better for that other person, for that person. Maybe because there's a psychological element that would work better for them. Um, or maybe there's a pain element that would work better for them. But what works for Joe doesn't necessarily work for Sally because it's not about this one fixed idea that's going to work for everybody. So hopefully, I've really just dipping our toes in here, but hopefully I've like we're peering out the window to the complexity that's here. Um, so yeah, I just want to make sure that we walk away with the idea that posture arises from a very complex interplay of both physical and psychological adaptations that includes the drive to minimize pain, as opposed to seeing it as this simple thing that causes pain. And, it's really only going to cause pain if there's something overriding those nociceptive goals. Something has to be more important to the nervous system than pain in order for that to be the case. So we want to make posture important, but we don't want it to make it the focus of any session itself. So we change that focus of let's work on your posture to what's going to feel good to you, what's going to be good for you overall, both physically and overall as a human being. So that's what I have to share. I'm offering a much bigger class where we dive deeper into this in a week, and I'll talk about that more at the end of this. But what I want to do right now is just open it up for any kind of questions that anybody has.
Hey Mark, I want to say thanks for hosting this. I feel like I learned a lot about kind of this perspective. I have heard kind of this idea that posture kind of relates to pain in this way, and so getting into kind of the details of like I thought it was really helpful to hear about like our, I guess, social and cultural perspectives about posture and how that more so drives this notion than any real scientific grounding. I'm just curious because you talked about nociception and the relation between nociception and posture and pain. Um, and it sounds like if there's anything, it sounds like there's a possibility that, let's say, I have kind of this, maybe I've had some kind of, I know you talk about trauma, but maybe I've had some kind of trauma in the past where my reaction or experience of pain is kind of influenced or inhibited. Um, that could kind of have like this inverse impact, I guess, on posture. Because it sounds like what you're saying is if I'm in pain, like if I'm sitting like this, then my posture will naturally correct to kind of mitigate the pain. So if
Mhm.
I don't have that pain, if I don't have that pain response, it sounds like I'm just curious as to like your thoughts on that of like um yeah, like kind of what comes of that then, like what would be the experience at that point.
If you don't have pain,
Yeah, like if my I have like whatever the case may be, maybe I've had trauma in the past, or maybe there's something physically in my body where I just don't experience pain in a certain area of my body. um yeah, like how does that relate?
oh, okay. So you're not saying like everything's fine and normal and I don't have pain. What does posture do? You're saying I've had trauma and as a result of it, it seems like I just don't have pain in that area, like it's turned off or something. Is that what you mean?
Yeah, I guess the word would be like numb. Yeah.
Yeah, that's really interesting. Right. So, well, one of the things that we know about trauma is that that the brain can uh, move attention to wherever it wants to go. So, if it wants to not feel pain, whether it's emotional or physical, it can do that. It has different ways to do that. Um, and uh, sometimes what happens, when we see this in neuroscience studies, is that that area of the body actually kind of gets ignored. And what I imagine is that the brain is saying, we're going to just not really consider that so much part of ourselves. And in extreme cases, the body isn't even aware, like it thinks of its leg as not a part of itself. There are cases like that. Um, But even if it still thinks of it of itself, it might devote less circulation to it. And so those regions often become the regions that end up having more pathology later on, but really because the nervous system just disowned that part of the body to some extent as a way of not having to really deal with it. Yeah, it's kind of like something like closet. You're like everything's in there and it's a mess, and I don't want to think about it. And so we're just gonna like keep the door closed. And yeah, I mean, if a leak formed, I wouldn't know about it because I'm not looking in there. Um, so am I addressing your question or no?
Yeah, yeah. No, that's really helpful. That's really helpful context. I did have another question. Um, I think Leah is saying that, or Sheila is saying that
Sheila,
she's.
yeah, thanks, Sheila.
Mhm. Um, from like a massage therapist perspective, what's possible then, if we're saying that, it's not really related to posture, what are some things that, um, we can talk to our clients about to help them if they're having this experiencing chronic pain?
Yeah, yeah. Well, I mean, it's a huge topic of so then what do we do? And um, how well the answer depends a little bit about like who's been trained in what here. But it's the first thing is we need to not go in with this simple rubber stamp cookie cutter mentality. We can't just say, "Oh, you have this pain, so therefore we need to, do this one thing to your neck." Like we can't think that way. Um, and a lot of times in massage therapy that's what happens is, oh, I see this, therefore it's related to that, and if we just fix that, then the other thing will start to resolve. But we don't really know what those relationships are. We really cannot determine those at all. And there's a long history of courses being offered for decades where there is a kind of a certainty being taught of fix X and then Y will take care of itself. There is no map like that. Um, so we have to get rid of that notion. And then the second one is to be curious about what is going on. And um, if someone comes in with this forward posture, with the shoulders rounded, it's kind of a protective position. What if that is for protective reasons? We can't assume that. We have to explore it. And, for some massage therapists, they may not want to go here, but that person might notice that if they try to shift into some other position because they think that maybe be better for them physically, maybe there'd be less pain, they might have this emotional response. So, um, you have to know that that could be the case. And but then we go into this other topic of massage therapists often think that they're releasing emotions. Well, no, that's the oversimplified view too. We're like, well, in this case, what you're doing is you're going in, you're trying to undo a protective pattern that's been there for a long time. So you better believe emotions are going to arise if you try to undo a protective pattern. That's just one possibility of many. Um, and we're not trying to be psychotherapists by any means, but we have to be real about what might be happening. And so, um, maybe that person doesn't really want to do that. And they don't know that. They don't know that that's why their body is doing that most of the time. So, the body is doing a lot of different things that we don't really have awareness of. And so there's a lot of humility that needs to, that's one of the biggest things here with posture is that a lot of humility needs to be present. If we're going into the topic of posture with a lot of certainty, then we got to dial that back. We got to really infuse it with a whole bunch of curiosity and just explore with a person rather than imposing. like this external agenda onto him.
I was going to interject it. And I'm dealing with this now, with especially with my mother. She's got horrible posture. She's had surgery and fusion on her lower spine. She's type A personality. We cannot get her to stand up, and she still now has psoas um, problems, and I cannot get her to just take 5 minutes to stand up. As soon as she gets up, she leans forward and she goes. And I'm trying to break her posture habit, and I think it is psychosomatic, but it also is, she doesn't give herself the time to stop for 2 seconds. And as soon as she gets up, I'm like, Mom, stop, stand up straight. And she thinks she is, but of course she's not. She's had fusion in her lower spine last year. She had hip problems, and then they said it was her back problems. So they did the fusion, but now she still has, and really I think it's deeper, like in her hip. But I can't break her habit of that posture. I'm just getting her to stand up straight, like,
Yeah,
and she's in pain.
yeah,
And she's retired, so it's not like she's sitting at a desk all day, or she's 70, she's about to be 73, no, about to be 75. And this posture thing, I cannot get her. It's the worst I've ever seen.
mm,
And it's not even that she's hunched over, it's literally almost at her hip, just leaning forward. She
uh-huh.
not And she said it almost hurts when she does stand up straight.
Yeah, yeah. Well, that's why she's forward, probably, right? Because it if it hurts to go into this position that we think of as the good or the right or the straight position, then that, I mean, then you're not going to do it, right? You're going to go into the position that feels less painful. And now, obviously there's just situations where sometimes you need to do this thing that might may not be comfortable at first. There are situations like that, but we don't know if that's the case here. It might be that the position she's in is the best one for her in terms of pain, or maybe being in that position is making things worse. It's really hard to actually know, what the case
And of
is.
course, she doesn't let me. She really needs some deep tissue, like in her glutes, her gluteus area. And of course, she won't let me do it. She can't. She won't let me, do deep work on her like that. She
Uh-huh.
can't take it. Um, Even
Yeah,
starting off, softer. I've been a massage therapist almost 25 years, so I know what I'm doing. But it's also a control thing. Like I said, she's very high type A personality, so she doesn't know how to let go. She doesn't know how to relax and let go, and it's very, very hard to work on her. um like, she thinks she's relaxed, the whole drop your arm, and just let she won't let go. And I
yeah,
think a lot of that is also causing her pain. And I just don't know how to break. I can't teach this the old dog new tricks type of thing. And but I'm telling her, and she's still in physical therapy, and even they tell her, you gotta relax. And in her mind, she thinks she's relaxing, but she's
mhm,
not. And
yeah,
it is the real, the personality, the type A, the control thing. She won't let go. She physically, her body physically won't let go.
yeah. Well, okay, so what I would encourage here is the idea of whatever a person's doing, there's a reason, there's an adaptive reason for it. Like that may be adaptive for one thing and not adaptive for another. They're not saying that whatever you're doing is totally fine in all respects, but it's fine in some respect. So, is it a psychological one? Is it a physical one? I don't know. Um,
Both.
but
Well, it's very hard to work on somebody. And I haven't, in all the years I've been doing massage, I haven't come in contact with a client or that has been as difficult as my mother is, as in terms of the mental and physical of that type of letting go or holding on, where their body is just so. And my mom, there is no trauma really. She's
Mhm.
had a pretty good life, and but her body, it's just I don't know how to break through that postural thing with her.
Yeah. Well, what I would encourage here is to not think about that there is some kind of postural thing to break through. Like I would encourage letting go of that.
Okay.
Not about trying to get into a certain position. It's not the case. It's very unlikely to be the case that things will get better if she just finds herself in a different position. Now, it is quite likely the case that if she doesn't move around, that that's going to contribute to problems.
And she does.
Okay, so moving around, like you're encouraging her to get up and move around. There's a lot of benefit for that, probably, not knowing all the, and everything there is to know, but in most cases, that's a helpful thing. But the posture itself, just um, let go of the idea that she needs to go into a certain place. And, but I would ask perhaps or explore, what is the benefit of the things that you're trying to get her to do, what find out what's the benefit for her of not doing them. Because there is a benefit. And
I'm
she,
not doing I'm not doing what?
what's the benefit of staying in that position? Or what's the benefit of not getting body work and that kind of thing? Because there's some, no, people don't just not do things for no reason. There's a reason. Now, the reason may not be known, right? But you can explore it like, well, it could be simple. It could be, yeah, it just hurts. Okay, that's simple. But it could also be, um, just a more, just I'm tired or I'm feel safer this way or I feel uncomfortable in some way that's hard to put my finger on, but it's not really physical. Um,
Also, she wants a quick fix. So everything with her, especially with the type A, she wants to be out of pain. That's
sure.
like the first thing. But she also is that typical New Yorker where she wants a quick fix for everything. And then so she started going through the process of so she had the fusion in her back, and of course that didn't do it. She had total knee replacement, and I think the total knee replacement is also what threw off her back. So there's been
Yeah.
some difficulties. It's like, and I've tried with her. I'm always she just needs more work. I tried working on her, and physical therapy, getting in a pool, keeping her moving.
Mhm.
Yeah, because she's almost 6 foot. She's like 5'11", 5'9". So, but
I mean,
I just think it's mental at this point.
clearly you care a lot about her and you really
Yeah,
want her to feel better.
yeah.
And it must be frustrating to not be able to help. Um,
But she has to
or-
do it. She has to take the time to, you know, give herself 2 seconds. Hey, when you get up before you start walking, stand up straight.
yeah.
And it's almost like a block. Like she forgets, or she just doesn't even think about it. And
Well, the other thing that I would want to say too is, try to let go of this. Well, I don't cover this in this little class today, but I cover it in my other class about like what are we doing as massage therapists? And the idea that we're changing the tissue is also not true. And so I heard you say about like she needs deep tissue but let go of the idea that you're going to change her tissue because
no, yeah.
you're
At
not,
this point,
well, or anybody's tissue. We don't change the tissue.
right.
What we do is we provide this this whole different sensation that allows for things to happen from there. But it's not because we're pushing really hard and we're like moving things around. That's not actually what's happening. So, and I tell you this so that you don't feel like there's something that she's missing in terms of, oh, if I could just get in there and like do something with the fascia or whatever, because you're not gonna do that anyway. Um, so
Well, I
what
mean,
you,
you can feel it. You can also feel in her. She's got psoas syndrome, and so you can. I mean, you can feel it in her body. You can feel it in her hip and her leg and her psoas and her glutes. Like I'm not the only one that's told her. Her
Uh-huh.
physical therapists have told her that, her it's tight, you know.
Yeah. But
Yeah,
tight doesn't necessarily translate into pain. I mean, they may be related, but it might be the cart before the horse there. It might be that it's tight because of the pain,
right,
because the muscles are responding in a protective way to the pain. So a lot of
right,
times we think that it's painful because it's quote unquote tight, but there may be truth to that, but we don't know it. But the muscles definitely respond when there's pain.
right.
So I wouldn't let yourself think that what you're feeling with your fingers is the problem. It might just be a symptom of the problem.
That makes sense.
Um, again, movement is super helpful, but we don't know what's going on in there. Like maybe there are nerves that are impinged, and if that's the case, that it's not a simple matter,
Right,
right? So, but it may not be that nerves are impinged. It might be a much more complicated thing. These are the kind of things I talk about in the other class. I get into all the details of what are the possibilities. Um, and so it's hard, we can't look into the body with a God's eye view and know what's really going on. But it's very common, of course, that the surgeries don't help, right?
right. Well, she's also a two-time cancer survivor. So
Mm.
they're also thinking maybe the radiation. She's had two different kinds of cancer. And so they're also thinking maybe the effects of radiation could be
Yeah. Is that
affecting her body. So,
when it kind of kick in after that?
yeah, I mean, she had, especially either the radiation or the chemo, she had a non-Hodgkin's lymphoma. So, and they gave her some pretty, strong chemicals to kill the cancer. So they're thinking maybe even the chemo, but more the radiation for the breast cancer. So she's a strong woman, but man, this issue with her posture, that's that's what's affecting her most in her life right now is the posture and her leaning forward and that coinciding with pain, I guess, in her back.
Does she want to be able to stand differently?
Yeah.
Yeah, okay.
Oh yeah, obviously. Because it's just
Okay.
gonna continue it's just gonna continue to get worse. And then her pain is going to get worse.
Yeah.
So
So it's a situation where she tries to get up and it's hard to get up and it hurts a lot to come all the way up, right?
well, it's not even it's not
Oh.
even the pain of her actually standing up. It's her
Mm.
mental, I think, block of doing the action. Because as
Mm.
soon as I see her get up, I'm like, Mom, stand up. Stand up straight. And then she'll do it. And she's fine.
Oh, okay. Okay. I
So
see.
it's like the mental block. I don't think she gives herself the time to fix her own posture. You know how
Oh.
we all lean over, like, hey, sit up straight, and you have to tell yourself to drop your. Because I sit at a desk all day. I'm a desk jockey during the day, and so it's like a lot of times I have to, hey, drop your shoulders, sit up straight. I have to tell myself to fix my own posture a lot of the times too. So
Yeah, but I'm telling you, I would encourage you to let go of that idea of fix it because you're not doing something wrong. If you like being in that position, now I get that maybe you're doing something at work that doesn't actually feel good, but you kind of have to like do it because it's at work. So that's a thing, get up and walk around occasionally would be helpful. Um, but like we shame ourselves into this like, oh my gosh, I have bad posture thing, and that doesn't help.
mm,
It's just not the case. You could buy one of those things that like beeps or something when you're not in the,
that's almost where I'm at to the point with her is maybe thinking about you know, getting her some kind of brace. And she actually, I gave her one of those, the back braces that Velcro, and she says it does help. And it does, like if she's vacuuming or something like that, and it's when she's around and just working around the house, it's just one of those Velcro belly bands almost. And she says it
well,
does help, and it
if
it,
it
it helps her from caving in.
mhm.
You
If
know,
it helps,
yeah,
then that's great, right? But what I'm saying is it might not help. So don't think that getting into what we think of as the right posture will necessarily help because a lot of times people do that and then they feel worse.
mm,
So if it feels worse, then that's not the right thing. But if she says that feels really good to her, then
I think it helps her mentally,
Mm.
reminds her, to not, at the 90, at her hip, to lean forward
Yeah.
if she's wearing it, especially if she wears it low, around her lower abdomen and lower back. I think it clicks in her mind to help
Mhm.
her.
Well,
You
that's
know,
great. It's good that you found that, and it sounds like sometimes pools happen.
yeah, getting her to move her legs and getting
Mhm.
her to, just motion, getting her to move.
Yep.
Yeah.
Yeah.
And like the physical therapist tell her too, she's got to strengthen her core. If she were to strengthen her core, that could, help her too with the
Yep.
posture.
And I also want to say that the whole strength and core thing, that's also not true. It's not about strength in the core. But if you do the things that develop core strength, you're moving. Okay, so again, it's the movement of it. And of course, it's great to build muscle strength. And there's a lot of, you also have a whole bunch of interesting endorphin and endocrine responses when you engage muscle. There's a lot of reasons to engage muscles, but it's not about strength reducing pain. It doesn't work like that. Um, so, if someone's doing it and they don't like it or that doesn't or hurts more, then just it's not about having, great abs or something like that. Yeah.
That
So
makes sense.
again, I think we shame ourselves if we don't have enough core strength, and we don't want to do it with shame. We just want to like do what feels helpful and good,
Right.
a little less pressure. So I hope that's helpful a little bit. We could talk about this for quite a while. I just want to, and I'm really glad that you brought this up, and it's nice that we have this, just us here to talk about it. Um, if um, oh, so next week I have the class. I just want you to know, same time, next week and the following week. And if you're interested in taking it, um, there's a promo code of Friends100 that you can use if you want. That takes $100 off the class, and you get 8 CE credits. NCB, TMB improved. Are you in New York?
No, Indiana.
Okay, yeah.
And I
So 8
definitely, we got to have some credits right now. I need 18 before
Hmm.
May, before the end of May for our renewal. So
Yeah, so these are 8, and I teach a trauma class that has 13. So those are 2 suggestions, just so you're aware. Do you have any questions about that? I have a slide I could put up, but
is the class during the day? Obviously,
yeah, at the same
during,
time from
during
1
the
to
week,
5. 1
1 to 5.
to
Okay.
5, next Wednesday and the following Wednesday.
Okay, that's not too bad.
And you'll
Very
get
good.
an email that will mention it too, so um, you'll have that. But
All
yeah,
right, great.
thanks a lot for coming today. And if anything else comes up that you want to, talk to me about, certainly reach out, and happy to talk more. And I hope that, your mom finds some relief and you can find some way to help her out more.
That's the process as of right now.
Yeah.
Okay, great. Thank you.
All right. Thank you.
Great. Thank you. Take care.